Good afternoon, everyone. This is Congressman Jeff Fortenberry calling, and we are doing a town hall meeting with Nebraskans on the coronavirus pandemic. What I'd like to do with you today is give you a brief overview of your federal government's response, and then have brief comments from Dr. Jeffrey Gold. Dr. Gold is the Chancellor of the University of Nebraska's Med Center and the University of Nebraska in Omaha, and we're really pleased to have him on the phone today. I also have the representatives from the Small Business Administration, Mr. Leon Mylabar. So this is, again, Congressman Jeff Fortenberry. For those of you who are just joining the call, it takes a little while to call all Nebraskans, so I'm going to repeat a couple basic pieces of information here and there through the call as more people join us. If you'd like to ask me a question on this call, press 0. Again, this is Congressman Jeff Fortenberry calling you, and this is a town hall meeting for your benefit to talk about the coronavirus pandemic and to hear from you and take any questions that you might have. If you can't stay on the line, though, I encourage you to leave me a message, or if you have a question, by pressing 1 on your phone. So 0 if you want to ask me a question now. If you can't stay on the line, press 1, and I'll be happy to review whatever your question or concern is. So again, this is Congressman Jeff Fortenberry doing a live telephone town hall with Nebraskans today about the coronavirus pandemic. Since this is a public service, we of course want to hear from you about what your concerns are, but if you could confine the comments to how the coronavirus may be affecting your health or your small business or your individual or family, that's most appropriate at this point. And again, I have Dr. Jeff Gold on the line with me from the University of Nebraska Medical System and Mr. Leon Mylabar from the Small Business Administration to take any specific questions in that regard. Your federal government is basically responding in 3 ways. One is to protect the healthcare system, to protect individuals and families, and to protect small businesses. And as traumatic as this has been for our nation, I'm just frankly really proud of Nebraskans. We have been very compliant. We understand the magnitude of the urgency here. There are so many beautiful stories of neighbor helping neighbor and people sacrificing for one another. But I fully recognize the trauma and difficulty that this has put so many people in. There is a lot of suffering. And we have a little bit of ways to go till we turn the corner on the virus and then assure our economic well-being. And there's a couple of things we're doing in that regard. By now, about everyone is familiar with the concept of social distancing. Our healthcare system has called for this in order to be able to stop the spread of the disease. That's part of the reason there's so many closures and isolations going on, dictates by the government. This is beginning to show some signs of progress as the spread of the disease in the hotspots, in places where it's most intense, is decelerating a bit. It's still going up, but it's not going up as rapidly, so it's a little bit of good news. Again, we're in Nebraska, and so we're fortunate in that we're a bit of the frontier, and even our urban areas aren't that dense. So we have the opportunity here to, again, take mitigating procedures to stop the spread of the disease by basic common sense things through hygiene, social distancing, and closures. This has caused a lot of trauma and difficulty as all of you have had to adjust to this reality, especially those who have been impacted by their work in the work environment. So again, on the second part of this, the federal government has not only increased significant resources to help our healthcare system find additional treatments, potentially find a vaccine, get the equipment necessary to those who are sickest, try to create the necessary movement of supplies to where they're most needed, even though that's difficult at the moment, and then be on standby for any additional help that's needed. The second part of this, though, is to help you and your family. So as a part of the last bill we passed in Congress, there is a check coming to most of you. If you make $75,000 or under, you're going to get a check from the government for $1,200 in about 3 weeks. If you're on Social Security or disability, you're going to get the same check. If you have children, they'll get $500 if they're below 17. Anybody above 17 who might be independent on their own, not claimed as a dependent, you'll get the full $1,200. In addition to that, there is significant resources to the third component of this, helping small business. So again, the idea here is to buy some time to stop the spread of the disease, help our health care system become more robustly enforced, look for better cures and a vaccine, and at the same time provide bridge help to small businesses who employ most Americans. We have done a number of these conversations, town hall meetings with small businesses in the last couple of weeks. There is a significant program out there called the Paycheck protection program, which starts tomorrow. So if you are a small business, I would research that quickly. Basically what it is, it'll give you a loan, and the loan will be for 2.5 times your average payroll from last year. If you keep people on the payroll, then that portion of the loan for your payroll costs, including rent or interest on a mortgage, is forgiven. In other words, it's a grant. It's inside of a loan. So this is a pretty good deal, and it is purposefully designed to move a lot of assistance from the federal government to the small business sector to help you stay in business. We very much realize how, again, traumatic this has been, how business is significantly off in a variety of sectors, and how people are hurting. So I want to go into that a little bit more if any of you have questions about that. But again, for right now, primarily what we want to do is hear from you. I'm going to give the phone over to Dr. Gold for a moment. And Dr. Gold, thank you so much for joining me today. He's extraordinarily busy. Again, Dr. Gold is the chancellor of our med school here in Nebraska and the University of Nebraska in Omaha. He's got a big job. He's got 2 big jobs. And the university, the Med Center, did Herculean work, heroic work early on to take in persons exposed to coronavirus, get them in isolation. We have specialized biocontainment facilities there in Omaha that have been on the front line helping people who contracted the virus early. Dr. Gold is an expert in a variety of fields, but is running a system that has deep expertise in contagious disease. And so Nebraska has been playing a leadership role not only in helping meet the initial demands of the coronavirus uncertainty by taking in patients, but also doing key research into possible treatments. So with that said, Dr. Gold, thank you so much. I know you're exhausting yourself in this national fight, but if you could give us a little bit of an overview about where we are with the disease nationally and some of the specific things that are happening in Nebraska, how we're fighting this, that would be very helpful.
Absolutely. Thanks so much for having me, and thanks for your kind words. It's a pleasure and an honor to be part of this great organization and to work with my fellow Nebraskans just here in the state and across the country. Well, today is a historic day in that the total number of confirmed cases just passed 1 million worldwide, with just over 50,000 confirmed deaths in this group. While this is probably an underestimate because of lack of testing around the world, it is a sobering number, considering at the end of December until December 31st, the number was 0. Indeed, it took 3 months to go from 0 to 300,000. It took from 3 days to go to 400,000, and it took another 2 weeks to get to 1 million. Here in the United States, we're at approximately 236,000 cases, and we're rising at about 25 to 30,000 a day. And indeed, the majority of this is on our coastal regions, and that has to do with that's where some of the early transportation-related contagion occurred, which then started to tax and overtax our hospital systems, particularly in the New York City tri-state area, but certainly in southern and northern California, Seattle, Florida, etc. Here in Nebraska, we have been incredibly fortunate and with good leadership, the partnerships among and between the state level, the counties, the cities, the hospital systems, and of course the University of Nebraska system to contain as much of this virus spread as possible. And we're at approximately 250 to 300 cases. We were at about 257 earlier this morning. I don't know exactly where we are right now with at least at that time of 5 confirmed deaths. One would compare that to the numbers in other parts of the country. And that's due to a combination of the fact that we're a rural and an urban state with widely spread population density, but also a state of citizens who follow the non-pharmacologic interventions, who are being very respectful of social distancing, are making great care if they're ill or if their family members are ill to stay home and to report situations that they might be concerned about. Shifting gears for just a minute, the university is very, very involved in not only the public health research about learning more about this virus, how it's spread, and how we can stop the spread of the virus, how we can reuse and preserve our personal protective equipment, how we can expand the testing capabilities, and things that are critical of that nature, but also very much involved in the vaccine and in the antiviral development, several critical public-private partnerships with startup and mature pharmaceutical firms, all aimed at getting the cures and the prevention therapy out there as quickly as possible. At the end of the day, until as a nation and as a community we have effective vaccines that can prevent the spread of the virus and effective antivirals that can treat people at the very early stages of the infection, we're going to be playing catch-up. We're going to try to keep the numbers down as low as possible to not overtax our healthcare system and buy the necessary time to get those antiviral therapies tested and employed, and to get vaccines that are both safe and effective scaled to production capabilities and out into the hands of the healthcare providers across our state and across our nation. More than pleased to answer any questions that you may have and look forward to them. And Congressman, thank you again for this opportunity.
Well, thank you again for your leadership, Dr. Gold. We're so grateful to have you in our state and at the helm of our flagship institution. We're very, very grateful. Again, this is Congressman Jeff Fortenberry calling. If you'd like to ask me or Dr. Gold or Mr. Leon Mylobar with the Small Business Administration a question, I'll broker those questions. I'll be the conduit here. But go ahead and press 0 on your phone, and we'll get to as many as we can in the next hour or so. Some Nebraskans are just joining the call here. Again, this is Jeff Fortenberry, Congressman Fortenberry, conducting a telephone town hall meeting with Dr. Jeff Gold from the University of Nebraska's Med Center and the Small Business Administration Director here, Mr. Leon Mylobar. Let's now go to Linda. Hi, Linda.
Hello, sir.
Hi there.
Thank you for taking my call. And
sure.
My first comment is thank you for making these phone calls so some of us can get more information.
Happy to help.
My question, of course, is senior citizen. My checks aren't big enough to pay taxes. Do I qualify for a check?
Yes. You're on Social Security, right?
Right.
Yes, you will receive a check, $1,200. There's nothing you have to do. It will come to you, okay?
Okay.
All right. Thank you very much. And by the way, it is not taxable. Some people have asked whether or not the check itself is taxable. It is not. But thank you, Linda. I appreciate you asking that question up front because it's important to so many people. Let's now go to, hi, Grace. Are you on the line?
Yes.
Hi.
I have two questions. One for you and one for the doctor. I would like to know from the doctor, when we get packages, we get cardboard packages from the mail and such, do we need to keep away from them for a while? And if so, how long?
Grace, that's a great question. This is Jeff again. Maybe Dr. Gold, you can walk through some of the common ways the disease is transmitted. It basically stays on hard surfaces longer than clothing or food or anything like that. Even I think it doesn't really spread by food. But that's a great question. Thank you, Grace.
Yeah, so we've done a good deal of research on that, Grace, and the answer to your question is hard surfaces. The virus does stick around for a while. The harder the surface, meaning glass or plastic or metal, longer. More absorbent surfaces such as cardboard, which your boxes are probably packed in, much shorter. There's no single answer to your question, but what most people are doing is wiping packages down. You just don't know how many people have handled them recently, and if you can take one of those, medicated wipes and wipe it down, it's a good idea. If not, if you let it sit there overnight, the chance of having any viable virus there, unless there was a huge amount on it, should get pretty darn close to nothing.
So it doesn't stay on cardboard very long, maybe 24 hours. Hard surfaces, longer, 48 hours. What about clothing, Dr. Gold, and food?
What about mail?
Or regular mail. That's good.
Yeah, again, mail is a porous surface, and therefore the viability should be relatively short term. Again, if you can possibly let it set overnight just to be absolutely sure that the last person, the mail handler that dropped it off in your box was okay, that would be our recommendation. You know, a lot of our mail is not in typical paper anymore. It comes in these plastic wrappers, you know, some of our magazines and other things that we get. Some of us actually still do get paper magazines and books and things like that in the mail. And so for all those reasons, an overnight stay or a quick wipe down with one of the wipes is still advised.
And Grace, you had a second question?
Yes, we keep hearing about the peak of the virus, and the thing I haven't ever quite understood is, what is the peak? How do you know it's the peak?
I'm going to let Dr. Gold handle that question.
Sure. Well, Grace, the way we're going to know it's the peak is we're going to start to see the doubling time of the virus start to fall, as it is in New York and as it has in Seattle and other parts of the world. And then we'll start to see the number of hospitalizations go down, and then we're going to start to see the number of people being tested go down. So we are still pretty much on the upswing of the number of cases in the United States, but we're starting to see parts of the country where, as a direct result of all of the non-pharmacologic interventions, the NPIs, we're starting to see the doubling time get stretched out. So what that's going to mean is that we're going to, as they say, flatten the curve. And what we mean by that is keep the total number of individuals who are infected, needing hospital beds, out of the hospital, out of intensive care unit, off ventilators, to protect our healthcare workers, to protect access to our hospitals for those individuals who need it. What that means is that we're going to stretch out the curve, because until we have an effective antiviral or an effective vaccine, the only way we can protect people is through the social distancing, the stringent hand washing, the cleaning of surfaces, etc.
Okay, great. Thank you, Doctor, for that thorough explanation. So in terms of timing, we're not exactly clear, but again, we have a little bit of good news in that the spread of the virus is slightly decelerating in certain places where it's very intense, and that's a bit of good news. And so if that deceleration continues, we will peak and then turn the corner, and hopefully that's in a matter of days or short weeks, given the nation's adherence to the social distancing and the isolations that we've painfully all had to take on. But thank you very much. Let's now go to Erna. Erna, are you there?
Yes.
Hi.
I read in the paper that the ethanol plants could sell a lot of alcohol, but there's a government regulation holding that back. A lot of the alcohol used in the hand sanitizers. So what about that? Because I hear that a lot of ethanol plants will have to close.
Yeah. Well, that's a good question, Erna. I think we've gotten that fixed. Ethanol is now being able to move into hand sanitizer. Again, I got a call over the weekend from the biofuels director here in Nebraska. It was hung up, and that has now been fixed. By the way, I have a particular position in the United States Congress. I'm the ranking member of the Agricultural Subcommittee on Appropriations, and so some of the biofuels considerations fall under our jurisdiction, as does the Food and Drug Administration, by the way. So I'm glad you raised the question, because this is an important component of our agricultural economy and really helps America diversify our energy sources. But right now they're hurting, but my last understanding is we've gotten that fixed now. So thank you very much. Let's now go to Doris.
And I can just add that I believe several of those contracts have already been let for some of the ethanol producing plants to ramp up the availability of hand sanitizer. So
okay, great.
You did, thank you.
Okay, you're welcome. All right, let's now go to Doris. And Doris, again, I'm just going to state my name. This is Congressman Jeff Fortenberry. We have people joining the phone call now. I'm on the line with Dr. Jeff Gold, the Chancellor of our Med Center here in Nebraska, and Leon Malabar, who directs our Small Business Administration here. And we're taking your questions. So anybody who wants to ask me a question, press 0. We'll try to get to it. And again, what we're trying to do here is to talk about the coronavirus, how it might be just statistics on what the nation is looking at, or what you individually are looking at. So, Doris, are you there? Go ahead with your question.
Yes. Do you hear me?
Yes, ma'am.
Okay. Well, I've been in business for 58 years with my daycare, and I'm really concerned about my kids. And I'm wondering why Nebraska City cannot close their bars and the restaurants.
Well, there has been an order given that you can't have more than 10 people congregate in the space. So this has really impacted bars, particularly, many of whom just can't do that. And so have either decided to close or to go to curbside service. The governor did give an order that you could take out drinks with the lids, as I recall. I read that in the paper a couple of days ago. It's a little bit of happiness there, I guess. But that's kind of where we are with that. So it's a difficult situation because, again, I was on the call with the Secretary of Agriculture a week before last to talk about our food supply. And one of the key things that we need to do here is keep the restaurant business not only afloat, but serving. A lot of people do depend upon service from restaurants for their primary meals. And so a lot of restaurants have just done heroic work of moving to takeout. Some are still open. But again, groups of more than 10 are prohibited. So that's where we are. Let's now go to Diana. Hi, are you there, Diana? Hi. Remember the Kelly family?
Yes, this is Michael.
Hi. Oh, hi, Michael.
Yes, I have a question and a suggestion. The question is that I heard today that there is going to be, the Speaker of the House is asking for a bipartisan committee to oversee the spending and to make sure that the money that of the $2 trillion that's being spent is spent wisely. The minority leader says that would be redundant. I don't know what he means by that. What's redundant about making sure that money is spent the way it should be spent?
I'm not exactly clear on that proposal. There has been some discussion about who is going to actually have oversight authority here. And frankly, there seems to be a little bit of a kerfuffle in Washington about whether or not Treasury itself will have certain oversight authority versus Congress. Ultimately, Congress does have oversight authority of funds spent. So that's the best I can do. Now, this morning I did co-sponsor a bill that actually puts together a blue ribbon commission to look at the entire pandemic, what went wrong in terms of why we weren't potentially better prepared, and what are lessons learned here. So I think we need to get in front of that for the next time around. So, and you had another question?
Yes. As expensive as drugs are, could we ask Big Pharma to forego some of that profit and the time that's remaining, and that more money be able to be spent by Social Security and all the medical funding that goes, so that there's more money out there to be spent for cures for the people that are sick with this current disease, rather than continue to be huge profits for the drug companies?
Thank you, Michael, for the question. We continue to have a very serious debate in Washington as to how to deal with the very problem that you cited, ever-escalating drug prices. Now, there's a little bit of good news. It's very slight in that generic drug prices have come down very slightly. Again, I have oversight responsibility on appropriations for Food and Drug Administration, and we have pushed aggressively for them to approve generics quickly and to create some different structures in which people can't simply manipulate formulas to continue profit-taking without a drug moving into the generic profile. So these things should help bring down prices. But the bigger question of why our drug prices are so high compared to other countries, because we basically are subsidizing their costs because they negotiate with us, is a very important policy discussion that is unresolved. While, again, there is debate about what to do with the high drug prices and how to maybe push the policy of negotiating, at least in government programs, by the way, which I support, I've gone ahead and written several bills that would address the drug problem one by one. One is on insulin. It is the drug that is taken by about 30 million Americans have diabetes. It's the most sought-after drug, and it has gone up nearly 1,000% over the last 20 years without very much improvement at all. There's a variety of reasons for this. Middlemen, law that basically gives perverse incentives, and a again, a dynamic in which insurance companies, drug makers, and middlemen are all profiting by escalating cost. So that needs to be fixed. And if we can do it with one drug by which the manufacturer would then be allowed to sell directly to the patient, I think it's possible that we could scale that across all drugs. So rather than continue to fight the same fights where nobody can agree, and I should add this, though, our drug company, our drug infrastructure in America, the research and the business, the businesses that are innovating and providing real cures for people, we do lead the world. And we do subsidize the world at the same time. So there's a very careful balance here between not undermining the incentives to continue to be a leader in the innovative space of drug development, and at the same time not unfairly subsidizing other people, or not necessarily negotiating, which could bring down prices, or not moving to drugs quicker to generic status, which again, and then again, the combination of bad law, again, certain dynamics that lend themselves to insurance companies, drug companies, as well as middlemen, benefit managers profiting off of ever escalating prices, that needs to be taken head on. So again, I'm trying to do it with one particular drug that is the most used in America, that could be scalable across the system. So I hope that gives you a little bit of insight. And once we get past this coronavirus, we're going to have to get back to regular legislation. But I appreciate the question. Let's now go to Catherine. Hi, Catherine.
Hello?
Yes, go ahead.
Oh, I must have pushed the wrong button.
Hi, this is Jeff Fortenberry.
I was calling about that disaster relief, unemployment. You can't never seem to get through that line on that. And I know people that are working part-time only made $5,000. Do they qualify for that?
I don't know the answer to your second question, but in terms of getting through, Catherine, if you'd be kind enough to send me an email, we'll try to work with you on that. I've had other people get jammed up, and we've been able to break through on their behalf. Since unemployment is run by the state, we're trying to refer these cases quickly to the state. So if you would just send me an email, go on my website, fortenberry.house.gov, and we'll try to get you someone quickly. I'm not sure of the answer to your first question. I just don't know, but we'll get you that answer. Okay.
That I know he don't have an email address. He don't have a computer because he don't make much money. And how do they get through to
Catherine?
Get this
Catherine,
done?
call me.
Okay.
My
Thank
number.
You.
Actually, on your phone, all you have to do is push 1 and leave me that message, and we'll call you back and we'll get through. Okay.
Okay.
Thank you very much for asking. And Catherine asked a good question. Look, I have a very good staff both here and in D.C., and we're here. We're here to try to help. And obviously we want to make sure that we are communicating actively with you individually as well as through the media about the broader conditions of the country as we fight this disease, but also what benefits are available to you. And if you get stuck, either as an individual or a small business and working through the government process, we're here to help you. Again, this is Congressman Jeff Fortenberry on the line. We're doing a live telephone town hall. I'm privileged to have Dr. Jeff Gold, who is the Chancellor of the University of Nebraska Med Center, on the line with me, and we appreciate his tremendous leadership in the country as we're facing this crisis. I also have Leon Mylabar, who is the Director of the Small Business Administration in Nebraska. So let's now go to Alice. Hi, Alice. Are you on the line?
Yes. This is Greg, and then
hi, Greg.
My name came up, but
sure.
On your time that they were talking about wiping down paper and boxes and that, and earlier we have heard that on hard surfaces 8 or 9 days. Did I understand that you say 48 hours on the hard surfaces? And then also right in there, they were asking about the alcohol, and we were told bleach, like a third of a cup with a gallon of water. Which of those is better? Or does it make any difference if you're using the alcohol or the bleach?
Well, let me let Dr. Gold more fully answer that question. I think we ought to be a little careful. I said 48 hours a little while ago. That's not definitive science, so let me back off of that. Let me let Dr. Gold give a more definitive answer to you, Greg.
Yeah, so the second question first, if you don't mind. Both diluted bleach and alcohol are both effective. Whatever you have better access to will both work. And as far as the virus is concerned, the data that people are dealing with has to do with when small fragments of genetic material, the RNA from a virus, can be detected. That's what these PCR tests tell. They don't tell you how much of that is actually living virus that can be infecting to someone, or that is actually dead virus that happens to have died and left fragments of its genetic material on the surface. So in answer to your question, yeah, we have been able to, and others have confirmed, that you can recover small fragments of genetic material days on a hard surface. But how much of that is alive, and even more importantly, how much of that could actually infect somebody, is actually unknown. And so the advice that we're giving people now is pretty simple. Just wipe down your surfaces more frequently, and particularly the surfaces that you use. And that would include everything from doorknobs to tabletops, of course, bathroom fixtures, racks, and make sure you take an extra amount of time when you wash your hands, a full 20 seconds. Please do use soap or use a hand sanitizer. And if you're going to use a hand sanitizer, also use a full 20 seconds as well. It may sound like it's an abundance of caution, but until we can confirm that the live virus lives for less than that, which we are working on in our labs and other places across the country and around the world, that we want to be sure that people are careful.
Greg, what did you say? You're mixing a third of a cup of bleach with a gallon of water? Is that what you said?
It should be about a 10-to-1 ratio. So
okay.
for every teaspoon of bleach, you want to put 10 teaspoons of water.
Okay. All right. Great. Thank you very much for the question. Let's now go to, hi, Larry, are you there? Larry? Someone from the Tassell family? Okay, let's go to the next person. If everyone will hold a moment. This is Congressman Jeff Fortenberry. We're doing a town hall, and we're going to take Margaret's question. Hi, Margaret.
This is Margaret. Thank you very much for what you do. I appreciate that.
Sure.
I have a question for Dr. Gold. I have ongoing Lyme disease. I've had it for 36 years. I am high risk, but what I want to know is, can I give plasma to help other people?
Well, the plasma that you've probably been reading about.
Yes.
So the plasma that you've probably been reading about that's in such high interest right now is the plasma from individuals who have had COVID-19 disease.
Okay.
And the reason for that is that these individuals have, for the most part, developed a pretty high titer, a high quantity of antibodies themselves, which can be purified in the plasma and then given to individuals who are struggling in hospitals and on ventilators. And the experience that had occurred at the time of the Ebola outbreak, now 5 or 6 years ago, demonstrated the fact that this immune plasma was extremely effective. And there's some good preliminary data right now that it will be helpful in certain situations. But as far as the safety of somebody with, ongoing Lyme disease who, is probably on a bunch of medications and others, I would say that it's probably not a great idea for you to give blood or plasma right now. And more so, hopefully you will not get COVID disease.
Could I ask one more question?
Okay.
I had what I thought about a year ago was COVID-19. I asked my doctor's office, I said, I really thought I was going to die. I was that sick. It was the same thing that I've got, that they're going on right now. I said, is it possible I could have had that?
So I would say the answer is pretty unlikely to non-existent, but pretty soon we're going to have a really good antibody test available, and you could actually be tested as to whether that was true or not. I mean, there is no question that somewhere around the world this virus was living in a bat cave or somewhere for a long, long period of time. So, and I don't know whether you happen to travel to parts of remote China and visit bat caves, but assuming you don't do that, I'd say your chances of having this disease back then would be extremely low.
Okay. Thank you, Margaret, for the question. I hope you feel better. Dr. Gold, maybe it might be a good moment to give a little bit more information on what you just said regarding antigens, the precursor to the antibody, and one of the keys to getting us past this disease and assuring our economic well-being at the same time. Preventing sickness and treating those who are sick comes first, but at the same time, assuring that people don't have the disease or have some built-up immunity to it empowers us to get back to normalcy quicker. What's the status of that research?
Sure. So there are three different types of research that are actively ongoing. One is the vaccine research. In other words, what are we going to do to immunize individuals long-term so that they can never get this disease again or not get it for a year, such as what we do with our flu vaccines. There are several clinical trials. There are at least 8, and soon to be 10 or 12, being run by large pharmaceutical companies in combination with large universities, specifically around building different types of vaccines. And I won't bore you with the different types, but the research and the testing is being done on multiple different types of vaccines. I am sure over a period of time, maybe somewhere between 12 and 18 months is what Mr. Fauci says, hopefully shorter than that, we'll have an answer of a promising vaccine that is both effective and safe. The last thing we would ever want to do is start to produce and use a vaccine that wasn't safe or a vaccine that was not effective and long-standing. On the antiviral component, that's a whole other story. I do believe there are a number of clinical trials that are going on now. One is one that we run here, known as the Remdesivir trial, which is a FDA-approved pharmaceutical that has some efficacy in various types of viral diseases, and it's now being tested across the country for efficacy in COVID-19 disease. Hopefully, they will reach a critical number of individuals who have been part of that clinical trial within weeks to know whether or not it's effective. If it is effective, that can be scaled rapidly and distributed across the country. Having said that, there's a lot of research going on chloroquinolone, which is quinine-like compound, been around for a very long time to treat malaria. It's been used for other rheumatologic diseases such as lupus. The clinical research is still pending right now as to the outcome of that, but it's being used for compassionate use in several critical care units across the country. I would remind everybody, though, that chloroquinolone itself, quinine, is not a benign drug. None of these drugs are benign, but it is not a benign drug. And so if one is to ever use it, you should only use it on the advice of your healthcare professional. There are a number of very exciting new modalities of antiviral therapy that's been ramped up, including in our own medical center here in Nebraska, that are in various stages of production and development that could be scalable within, I would say, 60 to 90 days at the most. Now, that may seem like a really long time, but if we're successful in flattening the curve of the contagion of this disease, that's exactly when we're going to really need the effective antiviral therapies. So a lot of hope there.
Okay, great. Thank you, Dr. Gold. Again, this is Congressman Jeff Fortenberry, and we have Dr. Gold, Jeffrey Gold from the University of Nebraska Med Center on the line, as well as Leon Mylabar, who's been kind enough to join us with Small Business Administration. Hi, Cheryl. Yes, Cheryl.
Yes.
Hi.
I just have a question. The governors and the healthcare workers have just been begging for weeks to get equipment. Isn't there some centralized way we can do that so that they're not competing against each other?
Yes, fair question, Cheryl. Thank you very much. And we have been working very aggressively on that. You've heard about the Defense Production Act, which has been in vogue to actually increase the production of respirators. but the basic medical supplies that are in short supply here and in a variety of places around the country depend upon a variety of manufacturers, honestly, many of which come from overseas, many of which are in China, which is a whole other issue which has to be addressed after this. I'm of the perspective that just like military equipment, we ought to make our medical equipment here, but we'll deal with that after we get through the crisis. But FEMA is a centralization source of some degree of coordination. They are moving this product in from overseas. It goes through the various emergency management systems here and health departments here in coordination with locales. Is it enough, quick enough? No. So you have a lot of point-to-point contact, people just trying to find supplies here and there as best they can. So as of right now, the supply of basic medical equipment is in the hands of the individual's institution and their own ability to buy it from their traditional supplier. I'd like Dr. Gold can perhaps give a little more insight into some of those dynamics since he's on the ground dealing with this as well.
Sure. So we in Nebraska do have some shortages of personal protective equipment. If you look at the number of hospital beds that are available, the number of intensive care unit beds, and the number of ventilators, which you've probably read about from other parts of the country, right now we are well positioned, and that is to say we have approximately double the capacity and occupancy than we're currently needing, and that's true for hospital beds in total. For intensive care unit beds, we probably have 3 or 4 times the capacity that we need, and as far as ventilators are concerned, we probably also have 3 to 4 times the capacity that we need as of today. So as long as we keep the social distancing and the non-pharmacologic interventions going strong in our rural and urban communities, we will not exceed those factors. And very importantly, while we've had a small number of healthcare professionals take ill with this virus infection, we have not seen anywhere near the number that have occurred in other parts of the country. We're doing everything we can to provide the personal protective equipment and, very importantly, the right training for these individuals. And we're, guardedly optimistic right now that if things don't change terribly much, we will get through this until a good antiviral or vaccine becomes available.
Cheryl, it's a great question. We've been trying to deal with the same issue of hearing a shortage here or there. If you do hear of something and want to send it our way, again, we've got Dr. Gold as a resource here. We have contacts with the Federal Emergency Management Agency, who we've been in robust dialogue with, as well as state emergency management and local officials. So it's a point-to-point issue at the moment of filling spot shortages, if you will. There's a little bit of good news on the horizon in that the supply chains seem to be coming up more robustly. That's not going to take care of the entire problem, particularly nationally, but at least it's a little bit of a ray of sunshine on this. So, again, the issue of certain things being produced and centralized under the Defense Production Act, that's going on with respirators, but the other basic supplies is not. So it's one of those dynamics that's a little difficult at the moment, but thank you. It's a very good question. Let's now go to Beverly. Hi, Beverly, you there? Hi, Beverly. Hi, a member of the Bross family? Hey.
Yes?
Yes, go ahead.
Yes?
This is Jeff Fortenberry here.
Oh, this is Don.
Oh, hey, Don.
I got a question for both you and the good doctor. There was something that I participated in many years ago, because right now, I'm 80 years old, and this was back in 1954. I was asked to participate in a test to try a drug. So I did. And in this test, different than what we're doing today, and I want to understand the way we're testing these new vaccines and these new drugs, because it doesn't make any sense to me, because it's completely opposite of what we did back then.
Well, Don, do you want me to let the doctor speak just as to what they're doing now in terms of vaccine testing? Would that be all right?
Well, just let me finish my question.
Sure.
Because back then, there was 2 million of us that was in the test for the vaccine. And today we test them on 40 people, and the 40 people we test them on aren't in the high-risk group. Back then we were in the high-risk group.
Okay, let's let Dr. Gold give a little insight on maybe the testing protocol today with the coronavirus, if that will help you, Don.
Yeah.
Yeah, absolutely, sir. So the testing comes in multiple phases. The first thing that happens after the vaccine is developed is it's usually tested in cell culture, and then it's tested in small animals, typically mice. Thereafter, it is tested for safety purposes only in a very small number of volunteers, typically 100 or a couple hundred individuals. And only after it's been shown to be effective in culture and safe in a small number of volunteers does it then go into what we call efficacy testing. And that typically is in the thousands of people in areas where the infection is prominent. And so what would happen is they would go to some of the high-risk areas where the virus is spreading rapidly and immunize individuals who have no antibodies, who are not been infected, and compare those to individuals who do not get the vaccine and see what the likelihood is of their getting sick, and if they do get sick, whether they get a less severe case of it. And so, and indeed, it is typically balanced by age, by gender, by ethnicity, etc., to be sure that these are representative samples that are taken. In other words, we do everything we can to be sure we look at a very broad spectrum of both safety and efficacy.
Okay, very good. Thank you, Doctor. Let's now go to Austin, and thank you, Don, for your question. Let's now go to Austin.
Hi, thanks for taking my call. I actually
Sure.
am curious why there's not more congressional presidential pressure on states like ours to have a shelter-in-place order. I mean, you're seeing these cases rise on the coast and just march towards the center of the country, and we're driving around going to Costco and Sam's Club like it's no big deal.
Yeah, well, I'll let Dr. Gold comment after I do. Obviously, that would be up to the governor. And so far, again, given the dynamics of our vulnerability to this being a little bit more spread out and, frankly, a compliant citizenry, I think we've held up pretty well. We've also, as the doctor mentioned earlier, got a very significant reserve of healthcare resources here, which is good. Now, we don't want people to get sick, obviously. And your question is certainly a valid one to be discussed. So when do you do this and when do you don't? Maybe Dr. Gold could give some insights.
Sure. Well, if there was a magic answer to do it or don't do it, believe me, every part of the country would have done it at the same time and have made the same decisions. But the university is very honored to provide data to the governor and to the public health officers on a daily basis. We look at everything from the number of confirmed cases and the capacity for testing, the percentage of testing that's positive, which is, by the way, varies between 5 and 10% per day in Nebraska, which is much, much, much lower than other parts of the country. We look at the number of hospital beds, ventilators, healthcare workforce. All of those different factors are provided to the governor and the public health officers on a daily basis, and then they make a decision. And that decision is not only based on the data, but it's based on what the citizenry of the state are actually doing. And, it could be that in your community, people are driving off to Costco and Sam's Club and other such things all the time. But I can tell you, as I look out my window, and I do travel, I live here in Omaha, the streets are empty. The social distancing in the food stores is being highly respected. The restaurants, no one's gathering groups more than 10 people. And it's not to say that we couldn't do more, but the amount of adherence to these non-pharmacologic interventions is extremely high in our communities. And, I guess that does vary from, city to city, town to town, and widely across our 500-mile state. But, until such a time that it becomes necessary to do more, this is the position that the governor and the public health officers have taken. It's not without consequence because if you think of it, it's not just the economic impact of going to a, quote, shelter in state, unquote, type of situation, but more so than that, people depend on these resources for their provisions, for their supplies in rural and urban communities. And if you start closing them down, and certainly you're not going to tell law enforcement to not come to work. You're not going to tell firefighters to not come to work. You're certainly not going to tell healthcare professionals to not come to work. People that provide groceries, produce, transportation, they need to come to work. So it's not all or nothing. And right now, obviously, the governor believes that we're in a healthy balance. That can change in a day or 2 days as we continue to monitor the data in a real-time basis. But I can tell you the university leadership and the governor's office, public health officials, the mayors, etc., have a daily briefing on this and go through this information with a fine-tooth comb.
Yeah, I'm glad you walked through that, Governor. Dr. Gold, that you have been regularly dialoguing with the governor. In fact, he relies upon your analysis to help make these decisions so that it is coming from a scientific basis. These are tough calls. It's not a perfect science, but it starts with data and science, and so that's important to know. Thank you very much. By the way, somebody was talking about the mail the other day. Postal workers are out there too, and just doing a tremendous job of keeping things running. It's something we don't think about very often, but they came to mind this morning. And a walk in my own neighborhood, by the way, I sure enjoy. I don't know what's going on out there, but a lot of children have taken to chalking on their driveways and sidewalks, and that just kind of makes me smile. But
including my grandchildren, by the way.
Good. But I digress. Let me answer a question that's come into us about the small business disaster relief loan program. Leon, maybe you could weigh in here. They applied for that prior to the Paycheck Protection Program, and they wanted to know if they could still apply for any of the new business loans that are just passed. Now, my answer is I don't think so, but what they ought to know is if they are eligible for the disaster loan, that those payments are going to be made by the SBA themselves, the principal and interest for a 6-month period. Isn't that correct, Leon?
The actual disaster loan, if it's an idle loan, the principal and interest are deferred for 6 months. That's where we're going ahead and just only doing a deferment and all of that. Regarding being able to apply for the payroll protection, you can apply for both loans, but you can only take one of them. And that's what I've been telling people. Talk to your accountant, look at their financial situation, and see which one has the better financial gain for you or help you in your recovery. One of them will have a greater impact, especially if you have a number of employees. That's what we're telling at this point. If you have an existing SBA loan, we at that point are providing, we are paying the interest, principal, and any fees to the lender for 6 months. You already have to have a traditional SBA loan.
So, okay, very good. That's the important distinction there. So on the disaster loans that this person apparently applied for, it's a deferment of principal and interest. On the traditional small business loans, 7A loans, you are actually paying the bill for 6 months.
That's correct. We will be paying the bill for 6 months.
And let me review right quickly the Payment Protection Program again, because this is a very important new piece of legislation that has been rolled out of Congress. It is designed directly to help small businesses stay afloat during this terribly difficult period in which there are so many grave dilemmas as to whether or not to lay people off, keep them working, move them to unemployment. This is an attempt by Congress to move hundreds of billions of dollars to the small business sector in the form of a loan. A big portion of the loan, though, could be forgivable if you keep people on the payroll. And that program opens up tomorrow for certain small businesses. So if you are a small business owner, I really encourage you to look at that, contact your banker even today, tomorrow, and get in line, because this again is designed for you to help your people and to remain viable once we turn the corner on the virus. So let's take a couple more calls. We'll go now to Shelby. You on the line?
Yes.
Hi. You've been waiting a while. Sorry.
That's okay. I have 6 questions here, and I'll see if I can get through some of it.
Okay. Try to compress them.
Only 6, right, Shelby?
Yeah, just 6. Sir, what are you doing for people that are running out of food?
Okay. Why don't you go through all 6, and then I'll try to give you a variety of answers.
Okay. I'll put 1 and 2 together. With the people running out of food, when can we get those refund taxes released?
Okay.
That's what they're waiting on.
Okay. All right. You want to throw out your other ones right quick, and I'll just give you broader answers?
When do you think businesses will be able to reopen?
Okay.
People are complaining that the non-citizens are going to get stimulus checks.
Okay.
How would you be able to tell if we have it when it's allergy and cold season now? And number 6 is, how can you help the truck drivers when fast food restaurants are denying them food?
Okay. Thank you, Shelby, for putting it all together.
Yep.
First of all, regarding food, you're in rural Nebraska, I see. So there are a variety of ways in which food assistance is delivered to people. We have the traditional SNAP program, food stamps. We have expanded the monies available for food stamps as a part of this last larger bill that Congress passed. There are also food banks. I don't know if there are any nearby where you are, but and then councils on aging if the person has difficulties because they are elderly. That's a couple of, and then ultimately, if you do get stuck, just call us, because we have a network of social services that are available to help a person in need. Regarding refunds of taxes, both payment as well as filing, has been delayed till July 15th. However, most people get a refund, so go ahead and file your taxes quickly in order to expedite the refund. When will businesses reopen? It's a bit of an unknown. We're trying to do 2 things. Step 1 is get the country well, and at the same time take step 2, which is provide the means to keep our economic well-being viable. That's why these business programs are so important, to provide subsidies, particularly to small businesses, to stay open. Regarding non-citizens, a non-citizen should not get that check. It is going to people with Social Security numbers, however. While I finish talking to you, Alan Fireherm, who's on my staff, he's going to probably text me a more elaborate answer on that. I don't know if that was specifically stated in this bill, that non-citizens could not get this, but I suspect it was. But we'll have to research that. Finally, regarding allergy and colds, I'll let Dr. Gold answer that, and I don't know your answer on truck drivers. It's probably just depends on where they are.
Yeah, so the only real way to tell the difference between severe allergies and the flu or COVID-19 or any other infectious disease is to get screened by a healthcare professional, and then to, if necessary, actually get tested with a throat swab, which is not a hard thing to do. So rather than getting in your car, the best thing to do is, if you're concerned, is just call up wherever you get your local health care, explain to them what symptoms you're having. They'll probably know about your medical history, your allergies and such, and they'll make a recommendation to you. Yes or no, you need to be seen. Yes or no, you need to be tested. And then if you do need to be tested, I'm sure they'll arrange it for you.
So one more thing, Shelby. Now, in regards to persons here illegally, they should not be getting this money, but permanent residents would, okay? Now, let's go to Laurie. Hi, Laurie. Are you on the phone?
Yeah.
Laurie? Yes, hi.
Hi. My question is regarding medications and where they come from. People are now getting on ventilators, but when they get on ventilators, usually they need sedation. And I'm concerned because many of these medications come from other countries. And should we become an adversary of those companies, can they cut off the supply chain?
Well, this is a great question, Laurie, and I'm going to take a stab at the answer in terms of the broader policy construct and what this means post-coronavirus. Look, we'll come out of this. We've got some rough weeks ahead, clearly, but we'll turn the corner. Hopefully, better treatments are on the horizon. Then we'll have a vaccine. We will buy enough time that our healthcare infrastructure can absorb the number of people who do get seriously ill, and we'll properly treat them. And then we'll build up a natural immunity, hopefully, to this as well, so it doesn't hit us. But there are some longer-term consequences to what's gone on with this aggressive globalization over the last 20 years, particularly in the area of both medical supplies as well as drugs. We are codependent, inordinately dependent on China for these drugs, and it needs to stop. That is my position. You're telling me we can't make these things in America? It needs to be made in America. That's not only for our own national security, but our own economic well-being. And if we're going to trade, we need to be in trading partnerships that are authentic with people that can be trusted. And there is a serious breach of trust here. So there's going to be a lot of reevaluation on my part, and probably on many others, as to how vulnerable we've made ourselves in the name of turning all of this supply chain over to multinational corporations who are guided by their quarterly profit. So, Dr. Gold, I'm sorry, that's my little tangent. Would you care to add anything?
I think you said it well, sir. You know, this country depends on drugs of all different types, generics and non-generics, that are either completely made in other parts of the world or some of their critical components are made in other parts of the world, which gets into two different and critically important aspects, which you're well aware, sir. One is in case we ever get into an adversarial relationship with that part of the world or that country, it puts a risk on. But secondly, we have incredibly stringent standards for quality and safety for drugs that are manufactured in the United States that we have attempted to put in place for drugs and drug components that are imported from other parts of the world. But the truth is it's never quite the same, and there have been a number of instances where that has not worked out quite so well over the years. And so for both those reasons, I think Congressman's concern and focus on this is very well placed and very timely.
Yeah, thank you. Okay, I'm sorry, everyone. We're going to run a little short of time to get to everyone's questions. We've got a lot of questions. It's been a great discussion, mainly on the dynamic of the health impacts of the disease. I can take a few more. If we didn't get to you, though, you're welcome to leave me a message by pressing 1 on your phone, and I'll review your question. And if it's something urgent, we'll get right back to you. But again, I'm grateful for everyone being willing to spend this much time with us, and grateful to Leon Mylabar, who directs the Small Business Administration, as well as Dr. Jeff Gold, our chancellor at the med school here in Nebraska. Steve, go ahead.
Congressman, thank God for you and all of our elected officials. You guys are in our prayers, as well as the doctors and nurses on the front lines. But I have a question, and that is, it just seems like we have a big problem here, and it's the communist Chinese. Not the Chinese people, but they're Marxist dictators. And I know you've been on the front lines being one of the most vocal critics of China with their blatant disregard for human rights, the environment, and now their reckless handling of the initial outbreak of this coronavirus. What actions do you see actually happening concrete after we've gotten everybody well and moving forward? How do you see our trading relationship with the communists changing?
Well, Steve, thank you very much for your prayers. They're welcome. And, one thing, I'm really hopeful that after we're past all this, as traumatic and difficult as it is, maybe we can look back and see some good things that have actually come to this, a refreshment of relationships, all this intimacy that we're spending in our homes, all this togetherness, I should say, that we're having in our homes is leading to a good, deeper reformation of some fundamental things, I think. But look, we first have to get past the disease. But you're right. China has this odd system it's a communist capitalistic hybrid system, and you have to ask yourself a couple questions. What is its intention? In fact, your question ties into a deeper philosophical question as to what the 21st century is going to look like for the world. And from my perspective, both political systems as well as economic systems and social systems, culture, if you will, has to be based in a principle called human dignity. If it's not built upon that, it's built upon power or transaction or the pursuit of material good, which ultimately leaves people wanting. So China has this very large economic nationalism. In a certain way, it kind of works. But it's repressive. It's authoritative. It offends the notion of what we consider to be normal and ordinary, this idea that each person has worth and dignity and then should be able to have the means to express themselves and pursue their gifts and talents. Whereas in China, where you have a social metric system which clamps down on people's activity, watches them, and no freedom of expression or really in a way movement, the enrichment of a few at the expense of the many, the pollution of the environment, all to prop up a system that is not only about economic nationalism, but is actually rapidly developing military infrastructure for their own particular interest. You have to question whether or not this trading relationship is worth it. A long time ago, when China, before I was in Congress, but it was decided that China could enter into the World Trade Organization, and so it set the stage for basically our manufacturing going there. They make the stuff, we buy the stuff, they have the cash, we run up debt, they buy our debt. So there's a hidden problem here, in addition to us being over-dependent on the stuff, is that they buy our debt because we can't get our fiscal house in order. And that's another level of problem. So it is a codependent, dysfunctional marriage that we have with China. Obviously, do we want a good relationship with China? Absolutely. Do we demand that China actually be a responsible member of the international community? Yes. Chinese have told me that, hey, we believe that there's room enough in the Pacific for two superpowers. It's a nice sentiment. But how are we going to work these things through? I can almost guarantee you, Steve, that after all of this, there's going to be a retrenchment and a rethinking about what free trade really means. Is this really free? $2 trillion? This is what this has cost us right now. In the name of free trade, moving stuff from China, we just spent $2 trillion to clean up what they've done to the world and done to us. And so do I want a conflict with China? Absolutely not. Do I want authentic, good relations with China? Absolutely. Do we need to stand for something deeper in the name of being good to Chinese people and maybe showing a brighter way that is based in human dignity? Yes. Are we going to be able to control their system? No. But do we turn our trading relationships, our manufacturing over to them? Do we consider human rights and human dignity as important a variable as bottom line profits on multinational corporations who, again, have gone to China for lax labor standards and lax environmental standards? These are big, big questions, and unfortunately it's taken this kind of crisis to move them to the head of the line because, we're so attentive to profits. And these are deeper questions, and I'm giving a little bit of a lecture here, and I apologize. I wanted to keep this more to coronavirus, but I'm sorry. So many of us have gone through a deeper trauma here. And again, those of us in public service have a particular task on hand to try to, again, deliver what we can, help to you, and create the infrastructure so that our nation is safe and strong moving forward. And so it just taps into some of my deeper sentiments. But thank you for the question. Let's now go to Tanya. Hi, Tanya, are you there? Tanya? I think we missed Tanya. I'm sorry. Let's go to the next person. Go to Cora. Hi, Cora. Are you there? Cora? Are you on the line? Yes. Hi, Cora.
Yes, I am.
Hi, Jeff Fortenberry.
I have a question that isn't totally related to the virus, because I know that our Lord Jesus Christ is going to protect us, and many have been calling on him to walk under his glory and his protection, and he will do it. And I don't know, we've been praying, and I haven't heard one question about his involvement in this, but he is very concerned, and he will answer our calls to him for his glory and his protection. But my question is this: I'm 87 years old, and I have been keeping abreast of what Washington is doing regarding our Social Security, our Medicare, and our Medicaid. And we're going to survive this this virus, but I'm looking further down the road about what Congress is trying to, and the Republicans particularly, they have given their cronies, the 1% of this population, a $1.5 trillion tax benefit. And now they're going to be looking at making the very poorest and weakest population in our country on how to pay for that.
Okay, Cora, I'll wade into your question if you like. I'll just go ahead and wade into it. Okay. Well, thank you so much. Your second, I'll take the second question since your first question was about the higher things, and obviously in government, and I'll answer your second one. The Social Security system is clearly a part of what we've decided as a nation to have a protective measure for people. You're forced to say it's your money. Sometimes we call these things entitlements. It's not an entitlement. You're entitled to your own money. So you're guaranteed a certain benefit through Social Security income as well as health care through Medicare. And those are very important programs. Frankly, I received Social Security when I was a child. The early death of my father put us into the Social Security program, and it helped get the family through. So this is very important to me. The question will be in the out years how we strengthen that so that it is still viable at the same levels for young people. But we've got some time on that. Medicare is a little bit different. Look, there are new healthcare models coming out by which we're going to do two things at once. We're going to improve cures, find better treatments, better management systems, and actually save money at the same time. And this is very important because the more that we are able to do this well and save money, we solve multiple problems. There are a myriad of examples out there in which we're going to different types of care models that are actually reducing cost for the individual in Medicare as well as the system and making them feel better. And so these are the new models that will be unrolling, and to the degree that we can continue to incentivize those in Congress, it makes a whole lot of sense. And then you mentioned Medicaid as well, and that will be the people in the state have decided that we're going to expand Medicaid here, and that will be forthcoming. But that's up to the state and the timing of that. So those are just hopefully a few answers to your questions. And then, Dr. Gold, if you can stay on the line for one more, then we'll conclude after that. Sean, you there?
Yes, Congressman.
Hi.
Hi. I'd like just to make a comment, and then I have a question for you. So, one, I'm very glad to hear about what you're saying about China, because in my opinion, their goal is to dominate the entire Eastern Pacific and upend the world order that the U.S. has been leading since World War II. So, thank you for just being aware of that. And then my question is, I've been seeing a lot of stuff in the news lately about some of the quarantine measures, and like the president said, we don't want the cure to be worse than the disease. So what are we doing to make sure that we're upholding those principles that we aspire to in the Constitution and respecting things like in the First Amendment with the right to peacefully assemble, where we, in the effort to try to protect from a disease, we don't go too far and overcorrect into more of an authoritarian construct of overriding those constitutional protections that we have?
Sean, it's a great question, and it was well put. And I think we're all working very hard to find the right balance. Obviously, this is an extraordinary time, and extraordinary times call for extraordinary measures. And most people see what the government has done in terms of restricting movement and restricting gathering in that light. Obviously, if we because of our own, if we undermine our own freedoms by not restricting them at the moment, by getting everyone sick and creating death and destruction, that clearly is not liberty. So what we've done is basically have a tacit agreement here that this extraordinary time calls for this extraordinary measure of certain quarantining, isolation, and prohibition on certain types of movements. I'm supportive of it. Again, I think that this is one of the primary purposes of government, to protect you, to keep you safe, protect the general welfare. So in those kinds of conditions, you suspend temporarily some of the notions of freedom that we ordinarily take for granted, but you try to get them back quickly. And that's the key here, that we move quickly back to normalcy. And that's why there's this twofold effort going on. One, to build up our healthcare infrastructure, look for treatments, cures, and again, we've got a good compliant citizenry here that speaks a lot, again, to choice and liberty, that people are recognizing that the nature of our system calls for us, for each individual to sacrifice a little bit of that freedom now for our ultimate long-term well-being and fullness of liberty once it's restored, combined with trying to keep afloat the small business sector so that we don't destroy our economic well-being in the meanwhile as well. So it's a 1-2 step happening at both in the same. But hey, it's a great question. You articulated it very well, and I'm appreciative of it. And for those of us in government, in power, it's important for you to remind us of that ultimately all these measures are actually to preserve our liberties, not to undermine them. So with that said, I want to thank Dr. Gold for being on the line. Again, the Chancellor of our University of Nebraska Med Center. Great job, Doc, giving a bunch of great information today. Leon Mylovar is also exhausting himself. He runs a small business administration here in Nebraska. He's always been available for questions. We're going to have a big rollout of this Paycheck Protection Program. So those of you who are in small business or know a small business person and want to encourage them to get moving on that, I would do so. So, again, I'm so sorry for what our country is going through, what you individually are going through, but as Nebraskans, we seem to be pulling together pretty doggone well, and I'm proud of that. So stay well, everyone, and thank you for faring so wonderfully in such a profoundly meaningful way in this time of sacrifice, both for individuals as well as community. Again, if you didn't get to your question, go ahead and press 1 on your phone, and I'll be happy to review that. And if it's something urgent, we'll get right back to you. Thanks so much, everyone. Have a good evening.